Long-term care, custodial care, nursing care are all considered basically the same thing in Medicare's eyes. But the big question is, does Medicare cover these items? Let's go answer that question and grab our nuggets of knowledge for the day, shall we? Hi everyone, this is Kristen Maka with Futurity First Insurance Group. If you haven't yet clicked that subscribe button or the notification bell, please do so. I would be very grateful for your help. I hope everyone is having a fantastic week. Now let's dive into this question. Does Medicare cover custodial care? We all know that as we get older, we will need help with our daily activities. Normally it starts out small, so things like cleaning, doing our laundry, maybe cooking, going shopping, things like that. A lot of people can rely on perhaps church groups, friends, family, even neighbors to be able to rely on them to help them with these kinds of life activities. And they're not necessarily put off by the fact that Medicare does not cover any of these homemaker type services. However, as health starts to wane and more we're needing help with more of the personal type of care, things like bathing, eating, dressing, toileting can become very strenuous at times for us to be able to take care of ourselves. And we don't really want to be seeking out our family members to help us. Maybe that's embarrassing for us, or maybe we just don't want to put that extra stress on those individuals that we love and we care about. So in those types of instances, we look to our Medicare insurance to be able to help us out with that. After all, Medicare covers medically necessary items. And one would think that being able to toilet and eat would be considered medically necessary under Medicare, and therefore covered under Medicare. However, unfortunately, the answer is no. Medicare does not cover services like homemaker services, long-term care services, custodial care, meal delivery, or 24-hour nursing care. Medicare will pay for part-time or intermittent care. For instance, let's say that you had a fall. That's something typical of an elderly age group. So you had a fall and you hurt your hip really bad, and during your recovery period, you need some in-home nursing care. That would be covered underneath Medicare as skilled nursing care. However, and this is a big but, there are limitations to this type of care. It covers up to 6 days, and in those 6 days, it'll only cover up to 8 hours, and the care can last no more than 21 days. Anything above all of that criteria is on your shoulders as the patient. So unfortunately, I've known several different people that have been in this situation, and it's very sad because they've put themselves in a financial sticky situation. Now, there are some types of situations as far as the part-time or intermittent care where Medicare will pick up the bill afterwards. Those situations are normally for hospice care. And hospice care is basically you are on your deathbed. The doctor has given you a time limit as saying, you've got so-and-so amount of days to live. So when it comes to non-covered services under Medicare, you're picking up 100% of that bill. And that can financially be very tough on people. So please make sure that you have a plan put in place for homemaker services, custodial care, nursing home care, long-term care, things like that. In another video, I will go over the different types of plannings that you can put in place to help take care of those situations. But for now, I think that we've collected enough nuggets of knowledge for the day. I appreciate all of my subscribers. Thank you so much. If you haven't yet clicked that like button for today, please do so. And if you need a refresher course on any one of the videos that I've made, please go back and search through my video log and like any of the videos that you go rewatch. Please take care. I'll see you next week. God bless.